Our bodies are, well, they're constantly trying to communicate with us, aren't they? Sending out signals, little nudges, sometimes pretty urgent warnings when something isn't quite right.
They really are, like complex communication systems, giving us feedback all the time.
But actually interpreting those signals,
Hmm.
that's where it gets tricky. Is that headache just, stress or something more? Is feeling tired just needing sleep, or is your body trying to tell you something fundamental?
And, adding to that complexity, as the material we looked at points out, some really serious issues can even start without any noticeable symptoms at all.
Exactly. So, for this deep dive, we're digging into this stack of sources you shared, articles, some research notes that explore exactly these kinds of warning signs and symptoms across, well, a whole range of health conditions.
Yeah, and our goal isn't to diagnose anything. Let's be absolutely clear about that right up front. This deep dive is an exploration of the information in the sources you provided. Our mission is really to help you unpack what these signals might suggest based only on this material and to underscore the absolute critical importance of knowing when and why professional medical help is necessary.
Because honestly, the most important takeaway from all of this is always, always talk to a healthcare professional about any health concerns you have. This is fascinating context from the sources, sure, but it's definitely not a substitute for proper medical advice.
Okay, so right away, the sources highlight just how fundamentally tricky the nature of symptoms is. I mean, while they are the body's way of flagging an issue, it's rarely a simple, clear message.
Yeah, it's less like a direct email saying, hey, fix this, and more like finding I don't know, a weirdly cryptic note left on the fridge.
Precisely. The material really emphasizes how symptoms can vary enormously, not just based on the specific condition, but even from one person to another dealing with the exact same problem.
And that point you made earlier about some serious issues being silent at first, that's a big one, isn't it?
It is. What we saw in the reading was that conditions like certain parasitic infections or even some brain tumors might be completely asymptomatic in the early stages. You just wouldn't know they were there based on how you feel.
Which really drives home why regular checkups matter, even when you feel perfectly okay. And then there's the other big challenge the sources mention, the sheer overlap of symptoms.
Absolutely. Fatigue, a persistent ache, stomach upset. These are incredibly common symptoms and could be caused by dozens of things, right?
Yeah.
And the vast majority are probably not serious at all.
Which is exactly why the sources come back again and again to cautioning against trying to self-diagnose based purely on a symptom list you found online or something.
They strongly advise against it because what a doctor does is look at the pattern of symptoms, their severity, how long they've been going on, and crucially, the context of your specific health history, maybe travel, lifestyle, all that stuff that no online list can possibly account for.
Okay, speaking of complex and sometimes, well, really misleading signals, let's delve into some of those unexpected invaders the sources covered. Parasites.
Yeah, the material introduced quite a lineup there. Things like roundworms, tapeworms, pinworms, whipworms, hookworms, but also lice, giardia, even things we think of more externally, like mosquitoes, bedbugs, and scabies mites.
A truly delightful roster indeed. So how do these various unwanted guests make their presence known, according to the sources?
Well, they describe different ways they impact the body. Some literally consume your food from the inside, which can paradoxically make you feel constantly hungry.
Huh. Weird.
Yeah, and others, like certain worms, feed on your red blood cells, potentially leading to anemia over time.
And the symptoms listed get pretty specific for some of them, right?
They do. For hookworms, which often settle in the intestines but can sometimes affect the lungs too, the sources mentioned anemia, brain fog, fatigue, stomach pain, and even swelling.
Brain fog from hookworms. Wow.
Yeah. And pinworms were linked to general GI tract upset, that classic symptom of anal itching, especially worse at night. But interestingly, mood disorders were also noted.
Mood disorders from a pinworm. That certainly wasn't something I expected to see. It really highlights how varied the effects it can be.
It's fascinating, isn't it, how symptoms can manifest so differently. The reading also detailed liver flukes. Now, these are rare in places like the U.S., but more common globally, often contracted from eating raw fish, watercress, or maybe contaminated water.
Okay.
And the symptoms listed were quite broad. Nausea, vomiting, abdominal pain, diarrhea, constipation, fever, chills, rash. Even shortness of breath, muscle aches, swollen lymph nodes, and sore joints. A really wide systemic response.
So something as specific as a liver flu can cause symptoms pretty much all over the body.
Exactly. And then the sources went into skin parasites or dermatoses. Scabies, which is a contagious mite, causes intense itching. The medical term is pruritus, and lesions that can actually look different in infants or the elderly. Diagnosing it often involves scraping the skin to look for the mites themselves or their eggs under a microscope.
Microscopic invaders leaving trails on your skin. Just wild.
And then there's pediculosis or lice, scalp, body, or pubic lice. They feed on blood. Scalp lice are known for causing itching and leaving behind nits, the eggs, stuck to the hair shafts.
Right.
Pubic lice might even cause small bluish-gray spots on the skin.
Unpleasant, but very specific clues, I suppose.
Another one mentioned was cutaneous larva migrans, which has the delightful nickname creeping eruption.
Oh, lovely.
Yeah. This comes from dog or cat hookworms penetrating the skin. It causes itching and a very distinctive kind of linear, raised, red, winding lesion, often on areas like the feet, legs, or buttocks.
You can literally see it moving.
Sort of the track it leaves behind. And then there was onchus ursicosis, or river blindness. This is caused by a worm transmitted by black flies, usually found near rivers. It leads to skin lesions, but is particularly known for severe eye problems, keratitis, cataracts, and potentially irreversible blindness.
Yeah, the name river blindness is pretty terrifyingly self-explanatory. It's just striking how different these parasite symptoms are depending on the type and, well, where they decide to set up shop.
And here's where the sources shared a case study that really, really drives home just how complex and misleading these signals can be. It was the story of an Australian woman.
Oh, this case was unbelievable. She had these migrating lesions in her lungs, her liver, her spleen, plus significant neurological symptoms like forgetfulness and depression, right? Going on for over a year.
Yes, exactly. And they were initially considering really serious stuff, certain cancers, autoimmune diseases, maybe unusual pneumonia. They were treating her with steroids, even some chemo, because the symptoms were just so unusual and widespread.
But none of those treatments were actually helping the neurological issues she was having, were they?
No, they weren't. And that's when brain imaging revealed a lesion. So during surgery, to investigate that lesion, they found something completely unexpected.
Yeah.
A live, wriggling 3-inch worm in her brain.
A live worm in your brain. Wow, I have no words. Wow.
It turned out to be a species called Ophidoscorus robertsi, a parasite previously only known to infect pythons.
Pythons. How on earth did a python worm end up in the woman's brain? That's bizarre.
Well, the source material suggested it was likely linked to her foraging and consuming contaminated wild greens where maybe a python had shed the parasite's eggs.
Right. Okay.
And the case was really highlighted as this surprising example of a parasitic infection presenting with incredibly complex, misleading symptoms. It also raised the point that zoonotic risks, diseases passing from animals to humans, might potentially be increasing, perhaps linked to things like climate change, bringing humans into closer contact with environments where these animal parasites live.
So the takeaway here isn't just that parasites are, well, gross, but that seemingly completely unrelated symptoms like forgetfulness or depression in certain weird contexts could potentially be tied back to something as bizarre as a parasite, and that the diagnostic journey can be incredibly difficult sometimes.
Absolutely. Okay, so shifting gears a bit from those external invaders, let's look at signals that relate more directly to the brain and mind itself, as detailed in the sources.
Right, and this section covered some pretty heavy topics, like warning signs for conditions such as early Alzheimer's or dementia, and also brain tumors.
It did. For early Alzheimer's or dementia, the sources identified several key warning signs that go beyond just simple forgetfulness. Poor short-term memory is definitely prominent, especially forgetting recent events or, asking the same questions over and over. And while some memory lapses happen with normal aging, this persistent pattern is more concerning.
And struggling with daily tasks they used to handle easily, that was mentioned too.
That's a crucial one. The sources referred to these as instrumental activities of daily living, or ADLs, things like managing finances, cooking a familiar meal, following directions. They noted people might have significant difficulty with these tasks, and sometimes, strikingly, they can't explain why or might even deny the problem exists.
That lack of awareness, is that common? It seems like it would make things really difficult.
The sources highlighted that, yes, a lack of insight, the term is anosognosia, literally without knowledge of disease, is actually very common in early Alzheimer's. and it can make recognizing the problem and seeking help quite challenging for families.
Yeah, I can imagine.
Other signs included becoming easily agitated or irritable, unusual visual processing issues, and developing delusions.
Delusions, like believing things that aren't actually true.
Yes, exactly. The material described believing things most people agree aren't real, often with a kind of paranoid flavor, thinking people are entering their home uninvited, that their medication is poisoned, or that a spouse is having an affair. It noted these could be early indicators.
Okay.
Hallucinations, so seeing or hearing things others don't, were also mentioned.
And the sources specified that visual hallucinations are sometimes particularly linked to Lewy body dementia, specifically.
That's right, that specific link was noted. Other cognitive signs included disorientation, like getting lost, even in familiar places while driving, for instance. And language difficulties, struggling to find the right words, maybe using incorrect words, or using descriptions instead of names, which is called aphasia. The sources were careful to differentiate this from normal age-related word-finding issues by its frequency and severity.
And changes in their usual personality or behavior, that seems like a big one.
That was also noted as a significant sign, doing things that are really out of character for them. Impaired judgment that might lead to uncharacteristic spending or risk-taking, or changes in socially appropriate behavior. The sources frame these as key indicators that something fundamental is changing.
So it's really not just about memory slips then, is it? It's a much broader pattern of changes in function, awareness, and personality.
Exactly. And the strong recommendation in all the sources is, look, if these types of changes are noticed, get a professional evaluation. Don't wait.
Okay. The material also covered warning signs for brain tumors. It was somewhat reassuring, I guess, to see the note that the odds of a headache overall being a cancerous brain tumor are actually quite small, less than 1%, they stated.
Yeah, that context is important. Headaches are common. However, the sources did list specific signs that could point to a brain tumor. Difficulty with balance or coordination was one, particularly noted with tumors in the brainstem, leading to clumsiness or instability.
And similar to the dementia signs, speech difficulties were also on the list for potential tumors.
Yes, slurred speech, difficulty being understood, or trouble finding the right words. Changes in personality were also mentioned, sometimes related specifically to frontal lobe tumors, which could lead to emotional dullness or, conversely, unusual talkativeness.
And vision changes. That makes sense if it's near the vision centers.
Right, blurred vision or double vision, which might occur with tumors affecting the occipital lobe where vision is processed. Seizures involving abnormal movements or behaviors were listed as a significant warning sign too.
And physical sensations like numbness.
Numbness, weakness, or tingling were noted, usually affecting one side or just part of the body or face. Regarding headaches, while most aren't serious tumors, the sources highlighted that ongoing severe headaches, especially those that are worse in the morning, maybe sometimes accompanied by nausea or vomiting, those could be a symptom, particularly if they're persistent and represent a change.
So again, it's the type and the pattern of the headache, maybe combined with other symptoms, that warrants investigation, not just having a headache.
Precisely. And just like with other conditions, the sources really stressed that detecting brain tumors early is critical for more successful treatment outcomes.
Okay. And beyond those specific neurological conditions, the sources also touched on signs that someone might just be struggling with general mental health problems distinct from conditions like dementia.
Yes, they described things like uncharacteristic behavior changes, such as maybe suddenly avoiding social contact or perhaps increased irritability and lashing out. Feeling detached was mentioned: isolation, emotional distance, maybe withdrawing from friends and family networks.
And that loss of interest in things they used to genuinely enjoy.
That was specifically called out. Markedly diminished interest or pleasure in nearly all activities. The term is anhedonia. The sources identified this as a core symptom of major depressive disorder, although it can show up in other mental health conditions too.
Sleep changes seem like a symptom that pops up across so many different health issues, both physical and mental.
They really are quite common indicators of something being off. Both insomnia, difficulty sleeping, and hypersomnia, which is excessive sleeping, were listed as potential indicators.
Okay.
Excessive worrying or maybe engaging in compulsive rituals were also mentioned as ways people might be struggling to cope with underlying anxiety.
And changes in appetite as well.
Yeah, significant changes. Either a noticeable lack of interest in food or maybe overeating that isn't really related to physical hunger. These were noted as potential signs of inner turmoil or anxiety.
And finally, the sources mentioned a symptom that is, quite understandably, flagged as needing immediate attention. urgently.
Yes, recurring thoughts of death or suicide. The sources explicitly called this a hallmark symptom of major depression and other serious disorders, emphasizing the absolute urgency of seeking help if this occurs. They even included mention of resources like crisis hotlines, really highlighting the severity.
Right. Okay, moving past the brain and nervous system, the sources also covered visible and physical signals in other parts of the body, and a significant portion of this section looked at potential cancer signs.
They did provide several specific examples there. Changes in urination or bowel movements were listed as potential signals for cancers like colon, bladder, or prostate. This includes things like blood in the urine or stool, maybe changes in the urine stream, persistent constipation or diarrhea, or painful or frequent urination.
Okay, things you notice in the bathroom. Makes sense. And then, of course, lumps or swellings are often top of mind.
Absolutely. Abnormal lumps or swelling are classic signs to watch for. A new lump or mass in the breast or under the arm was described as the most common symptom of breast cancer, often felt as a painless, solid mass, maybe with irregular edges.
And the material made a point there that I think many people might not immediately consider.
They did. They specifically stated that breast cancer can occur in men. It accounts for about 1 in every 100 cases, they said.
Wow, 1 in 100.
Yeah. And symptoms in men can include a lump or a thickening in the breast area, or maybe swelling under the arm or near the collarbone, which might indicate the cancer has spread to the lymph nodes.
That's a really important detail from the sources to highlight. Changes in testicles were also listed for men.
Right. Any lump of any size, a change in the size of the testicle, swelling, or a feeling of heaviness can be a sign of testicular cancer. The sources noted this is most common in young and middle-aged men and encouraged regular self-examination just to spot changes early.
Ongoing pain in certain areas was also flagged as a potential sign.
Yes, persistent abdominal or stomach pain could relate to pancreatic cancer. Back pain might potentially be spinal or colorectal cancer. And pelvic pain was noted as a potential symptom of testicular, prostate, or colon cancer. Again, potential signs.
Difficulty swallowing or constant indigestion were mentioned too, things that might seem minor.
Right. But the sources stated that persistent difficulty swallowing or a constant painful burning sensation in the chest or throat, what we often just call indigestion or heartburn, these are not normal effects of aging and could be symptoms of throat, stomach, or esophageal cancer.
And a cough that just won't go away. That's something many people worry about, especially if they smoke, but even if they don't.
It is. The sources recommended seeing a doctor for any persistent cough lasting more than, say, 3-4 weeks, or any significant change in a chronic cough someone already has. While it's often something less serious like bronchitis or acid reflux, it can sometimes be a symptom of cancer.
And visible changes on the skin, moles and things.
Yeah, sores that don't heal or moles, warts, or freckles that change in color, size, or shape should definitely be checked out. The sources specifically noted that men actually have a higher death rate from melanoma than women, highlighting the importance of checking skin regularly for everyone, but maybe especially for men.
Good point. The material also gave a list of other breast cancer signs beyond just finding a lump.
They did. They included changes in the skin texture over the breast, like scaly areas or thickening, and dimpling, which they described strikingly as the skin looking like the surface of an orange peel.
Right.
The term is peau d'orange, which is sometimes linked to inflammatory breast cancer.
Okay.
Other signs listed were nipple retraction, where the nipple pulls inward, nipple discharge, especially if it's clear or bloody, and overall swelling or a noticeable change in the size of one breast compared to the other.
And consistently with all the other symptoms we've discussed, the sources were really careful to point out that while these could be cancer signs, they can also have totally non-cancerous causes, but they still require evaluation by a professional.
That nuance is just so critical. It's about awareness leading to action, not panic.
Exactly. And finally, that analytical report included some more general visible signs of potential poor health, sort of broader indicators.
Right, those are things like changes in skin and complexion. Pallor, for instance, unusual paleness might suggest anemia or maybe poor circulation. While jaundice, that yellowing of the skin and eyes, is often a sign of liver dysfunction.
Oral health cues were also mentioned, surprisingly.
Yeah, things like gum inflammation or bleeding, persistent mouth ulcers,
Yeah.
even chronic bad breath or halitosis can sometimes be linked to underlying systemic issues like diabetes or liver disease, not just, needing to brush better.
Interesting. And visible issues with mobility or posture.
Difficulty walking or coordination problems might point to neurological or musculoskeletal issues. And things like stooped posture or Persistent joint pain could indicate conditions like arthritis, osteoporosis, or maybe spinal problems, just more clues the body might offer.
Wow. Okay, we've really covered a huge range of ways the body can signal distress, haven't we? Drawing from all these sources from, microscopic mites causing skin changes to
Yeah.
subtle shifts in memory or behavior, right up to potentially alarming things like unexpected lumps or significant pain.
And the single most important message woven throughout all the material we looked at, the absolute central takeaway, is that these signs and symptoms are potential indicators. They are clues. They are not diagnoses in themselves.
So, what does this all boil down to then when you notice something like this in yourself or maybe in someone you care about?
It means, as the sources strongly recommend, it's time to see a doctor. Simple as that. They are the ones equipped to put all these potential clues together in the right context. They can conduct a proper physical exam, take a full history, including things like travel or diet that might be relevant for some conditions, and then order the necessary tests.
Tests that go way beyond just looking at a list of symptoms online.
Exactly. Things like blood tests, imaging scans like X-rays or CTs, maybe biopsies for lumps or suspicious areas, or those specific tests mentioned for conditions like examining skin scrapings for parasites or looking for nits with lice. For something like potential liver flukes, they might ask about travel or exposures that happened years ago. A doctor puts the whole picture together.
And this is where that point about early detection becomes so critical, especially for the really serious conditions.
It's absolutely vital. The sources stress this repeatedly. For conditions like cancer or brain tumors, catching them early based on noticing these potential signs and getting evaluated promptly often leads to much more successful treatment and significantly better long-term outcomes.
And the sources even noted that for certain cancers, like ovarian cancer, there isn't actually a reliable routine screening test widely available yet, meaning symptom awareness is particularly important for that specific condition.
Which perfectly underscores the value of listening to your body, trusting your gut when something feels off, and seeking professional help, especially given how varied and nonspecific so many symptoms can be.
So, reflecting on this whole deep dive, we've seen this incredible, sometimes really bewildering variety in how the human body attempts to signal that something's wrong. From subtle shifts in complexion or energy levels to really unmistakable physical changes or significant neurological issues.
And the information in the sources, it provides valuable awareness, right, of what could be potential signs. But its true value, really, is in prompting you to consult a healthcare professional rather than maybe falling into the trap of self-diagnosis or unnecessary worry based on incomplete information.
Yeah. Listening to your body isn't about jumping to the worst possible conclusion every time you feel a twinge. It's more about respecting its signals, whatever they are, and actively advocating for your health by seeking qualified guidance when something feels off or changes persist, especially knowing how much symptom overlap exists.
It's treating those cryptic messages not as definitive answers, but really as calls to action, calls for expert interpretation.
So here's a final thought for you to consider, sort of building on this whole dive into the body signals. Just ponder the sheer mind-boggling complexity of the human body for a moment, how it uses this vast, sometimes really confusing array of symptoms as its own unique way of trying to get our attention. Asking for help and understanding in a world where, honestly, 1,000 different things could explain any given feeling. What does it truly take for us to listen properly?